Joe Flower here. Will this great red, white, and blue country of ours ever find a way to do what every other advanced economy in the world manages to do? Make sure that everyone's medical needs are taken care of? Since the midterm elections in November 2018, everyone is talking about it again, for 3 reasons. Republicans found they could no longer get votes reliably by beating up on Obamacare. Democrats ran on big, strong health care promises and won the House by a landslide. And a federal judge found Obamacare unconstitutional, putting a lot of people in crisis mode. Something's got to be done. Everyone's talking about it, but a lot of what they are saying is wrong, wrong, wrong. Here are the top 10 myths about universal health care that just keep hanging on. I explain each one at greater length in other videos, but here's the rundown, the top 10 list. Number 1, universal health care, Medicare for all, single payer, they're all the same. Not. Let's start with universal. Universal means just that, universal. Everybody's healthcare needs are taken care of one way or another. But there are lots of ways to do that. It isn't just one thing. Take Medicare for all. That is just one way to do universal coverage. Medicare is a single payer, the government, paying private providers for our medical care. And even Medicare for all isn't one thing. The new Democratic House is considering 8 different plans for expanding coverage, including 3 different Medicare for all plans. Then we come to single payer. There's a lot of confusion about that. Single payer means only that there's only one payer for any of these plans that we as a country might choose. Single payer doesn't mean anything more than that. When we hear that someone picked up the tab at dinner, that doesn't tell us anything about where the folks ate, what they ate, how the meals were prepared. So single payer doesn't indicate anything about the type of health care we'll get. It certainly doesn't by itself tackle the cost problem. Myth number 2, universal health care has to cost way more. People assume that the amount paid in taxes for health care will inevitably be greater than the amount people and their employers pay now in health care premiums. It could cost more, but it doesn't have to. Every other advanced country has universal health care, and they all cost about half what we do. Now, it is true that if we simply covered everyone for everything all the time without changing anything else about our system now, then yes, it would cost way more. But there are huge opportunities to drive the costs of healthcare down. So if the same universal health plan also took these opportunities to drive the costs down, then no, universal healthcare does not have to cost more. Myth number 3, controlling costs of a universal system will have to mean rationing. No. That would seem to make sense. If you're spreading some commodity around to more people, you're going to have to limit how much they all get, or it will cost way more, right? But not in healthcare, simply because there is already so much waste, so much being done that does not need to be done, so much done in the most inefficient, expensive way possible, that the way we do it now costs at least twice as much as it needs to. We can mine that waste and redirect those resources to help people who are not getting help now without rationing anything. Myth number 4, universal health care will cost way less. Now look, bless our little American hearts, but a lot of the people against universal health care just think the government screws everything up. Everything is a $5,000 coffee cup. Everything is a $1 billion overrun. So of course it's going to cost more. Way, way more. Now, a lot of the people for universal health care believe the exact opposite. Put the government in charge and we won't have to put up with all this stupid overpricing and ridiculous costs. The government can just dictate all that, so of course it'll cost way, way less. Every plan being considered by the new Democratic House claims that the government will control cost, but it's not clear how they propose to do that. What's the mechanism? How's that going to work? Now, we don't have to speculate what a simple Medicare for all plan would look like, because we already have Medicare for some. It's just limited to people over 65 and people with certain medical disabilities. It does attempt to control costs. Does it actually cost less? Only somewhat less per person. It's only somewhat more efficient, not massively so. The folks at Medicare do good work most of the time, but Medicare is still massively prone to funding overuse and waste. Why? Here is the core truth. The most important thing to know that is usually missing from analyses and reports to the general public, but which is common knowledge inside U.S. healthcare. So pay attention. What makes us way more expensive than everyone else on the planet really doesn't have to do with whether we are covering everyone. I know that's surprising, but it's true. What makes us way more expensive than everyone else is how we pay for healthcare. We don't pay for results. In a fee-for-service system like ours, we just pay for the healthcare system to do stuff to us. We pay fees for services. Now think about it. We pay for a lab test, a doctor's visit, a drug, a surgery, not to fix us or keep us healthy. When you pay people to do stuff to you instead of paying them to make you healthy, what do you think happens? The system tends to do as much stuff as possible, to do it in the most expensive way possible, to charge as much as it can get away with. It's normal. It's how systems work. Now, in that system, there are plenty of folks in the healthcare system who are trying to do good work, trying to make people healthy, but they're trapped in a fee-for-service system that only pays them for doing more stuff faster and penalizes them financially and career-wise for doing what would truly be best for you, the patient, often at much lower cost. I explain this more in another video. So this situation creates a lot of waste, overtreatment, insanely high prices in every single part of healthcare. Obvious when you think about it, right? Now, if we changed all that, if in a number of different ways we paid for results instead of stuff, we could easily take care of everyone for half or less of what healthcare costs us now. We could all get what we really need and want at a cost we can all live with. Again, I explain how in another video. If we don't change what we pay for, it won't be cheaper than what we have now. If we changed how we pay for things in the same universal health care plan, if we stopped paying for waste and overtreatment, stopped paying high prices that have no real basis, stopped dealing with chronic disease in the most expensive way possible, then universal health care would not have to cost more and could cost way less. Myth number 5. Universal health care means government-run health care. It means socialism. Well, no. Medicare, for instance, doesn't own any hospitals or clinics. It doesn't employ any doctors or nurses. That's what socialism is. Nationalized, state-run healthcare systems. Medicaid, our sort of universal system for the poor, it doesn't employ docs and nurses either. The services are almost all delivered by private systems. Around the world, we see a wide variety of ways to provide health care for everyone. For instance, Canada, Denmark, Norway, Sweden, they all have single-payer systems, much like our Medicare, just for everyone. Their governments pay for care that is delivered privately. Great Britain, Spain, on the other hand, have national health services. The government pays the doctors, owns the hospitals. Germany and France, they have multiple payers. They have private insurance companies and public ones for the poor and disabled, all tightly regulated, paid out of various funds, but everyone is covered. There are lots of ways to do it. I explain some of them in more detail in other videos. Myth number 6. Universal health care means turning over our lives to a massive bureaucracy. Wait, what? As opposed to now? Have you ever tried to get a health plan to pay a bill that they have rejected? It's worse than one massive bureaucracy. It's multiple massive competing bureaucracies. The hospitals have huge staffs to try to get paid by the health plans. The health plans have massive staffs that try to not pay a dime more than can be ripped out of their hot little clutches. States have bureaucracies regulating hospitals and insurance plans. The feds have multiple bureaucracies. And here's a key point in this debate. Medicare, the largest government healthcare program, spends far less per person on that bureaucracy than the private health plans do. And the amount Medicare spends per person has been going down since 2005. There are all kinds of ways of providing universal health care. Done right, it could actually mean less bureaucracy not more. Myth number 7. Universal health care would mean abandoning today's free market health care. No. Today's healthcare market is not a free market. It's highly regulated. It's a constricted market in which the ultimate consumer, you, have no power. It's not really a private system or a government system. It's a private system that is constrained by government under all kinds of legal and licensing requirements, which have been haphazardly built up by the healthcare industry itself over the last century, not only to protect patients, but also to protect its own rights and privileges. And now they are in such a tangle that hospitals have whole huge compliance departments dedicated just to making sure they follow all the regulations. And the people who run them will tell you that it's ultimately impossible, since the regulations and the definitions from all those different directions contradict one another. No, we don't have a free market in healthcare today. Myth number 8. A universal system cannot work. It cannot sustain itself if people who are not working, and therefore not paying taxes, are able to use it. Of course it can. That's what a universal system is for, to make sure that people can get help, whether they are in a position right now to pay into it or not. It spreads the cost across generations, across rich and poor parts of the country, across the sick and the well. This is what Medicare, Medicaid, federally qualified community clinics, the CHIP funds for children's health care, and other such programs are for, is to help people who are not working, people who are not working because they're too sick, people who are retired or otherwise too low income to be paying into the system. Myth number 9. Immigrants inevitably draw more out of a universal healthcare system than they pay into it. This is provably false. There have been multiple studies looking at the question in different ways. Even recent immigrants are desperate to make a living, build a business, provide for their families. They want to be taxpayers as soon as possible, and most of them succeed. It's a very American story. And the studies show that not only do they pay into the tax system and Social Security system, they pay more than their share because they actually tend to use Medicare and Medicaid less than other Americans. Finally, myth number 10. Research and innovation are what make U.S. healthcare expensive. If we reduce the amount we pay for healthcare, we will get less research and innovation. No. Research and innovation are not what makes U.S. healthcare expensive. There are no data supporting this notion. The claim of pharmaceutical companies, for instance, that it cost them all those billions to develop new drugs is a simple assertion that they have not backed up with facts. Moreover, research and innovation does not need to be funded only by higher and higher costs for patient care. There are many other ways, such as direct government grants, private funding for startup companies, pharmaceutical companies and device manufacturers funding their own research. And if you think about it, you'll see that much research and innovation could actually be used to lower the cost of healthcare rather than raise it. The way CT scans and MRIs, for instance, have taken the place of a great deal of exploratory surgery, and laparoscopic surgery gets you out of the hospital faster. Research into emerging areas of medicine, such as functional medicine, can treat chronic diseases at a much earlier and more manageable stage. The right kinds of research and innovation can actually lower costs. So, let's go over this again. What does actually cause high prices? A fee-for-service payment system that encourages and even demands 1. Vast overuse, doing things we really don't need to do. 2. Waste, doing things inefficiently and in the most complex, expensive way possible. 3. The lack of any true competition on price and quality. 4. Prices based on nothing more solid than what they can get away with. 5. Biases toward old, ineffective, and expensive models for treating chronic illness. That's what makes our system so expensive. Will this Congress bring us universal health care? No, not this Congress, since it's still a partisan issue, though there is no need for it to be, and we still have a Republican Senate. What can happen, and will happen, is that by considering and debating the possibilities, and possibly actually passing a bill, the Democrats in the House will manage to reopen the discussion, refocus the political discussion to how can we do this? What would actually provide health care to more Americans, maybe all Americans? What would actually lower costs? What would actually widen the definition of what is covered to emerging new models of medicine that are lower cost and more helpful at the same time? Can we do this? That's the good news of the present moment. We can actually have the discussion that has been denied us for most of the last decade. That is, what would work? What are you going to do to make sure we have this national conversation? Tell me in the comments. You can subscribe here for more videos, and take a look below for links to the more detailed explainer videos that I mentioned in this one.